What's going on, guys? Welcome back to my channel. If you're new here, my name is Weston Boucher, and per your request, based on my last video where I talked about my experience thus far this year being on testosterone replacement therapy, we got a huge response on that video. You guys were definitely after me bringing my doctor on for this next video. So we went through and looked at all the most prominent comments that we felt like we should really dive into, and to just give you guys some clarity on this really kind of gray issue that a lot of guys are super interested in, but they just don't know a lot about. So without further ado, here we go. We're going to dive into it. Thanks for being here. Let's do this. Alright guys, before we get too far along, please do obviously hit that subscribe button if you end up enjoying this video, as with my channel I talk about all things men's self-improvement. Make sure you like the video, make sure you comment. The YouTube algorithm really favors those things, so if you really want to help support right this moment, that's the best way to do it. The next most practical way to support my channel is to support my menswear line, and check it out. I actually just released my new toiletry bag called the Traveler. I spent the last year developing this. It turned out amazing, and it makes an incredible gift for any guy that's sure to love. Ladies, if you're watching this video for some reason and you need an idea for a gift for your guy, or if you're a guy and you need to put something on your Christmas wish list, this is the one to have. I only have limited quantities, so you're gonna wanna buy right now, and make sure that you guys use my YouTube exclusive code that you're gonna see on the screen right now. And check out my line in general at westonjohnboucher.com, as I have a lot of products in there you're sure to love. I'm actually wearing a cardigan that is one of my prototypes, so stay tuned for all the fall releases that are coming up. And as we are getting into colder weather, check out my quarter zip merino wool sweater, as there's still ample stock of those in, let's see, I think I have a lot of the dark gray, and then I also have the alabaster, and then the dark army as well, so check those out, guys. Alright guys, so as you know, if you saw my last video, I decided to start a TRT, HRT, hormone replacement therapy, or testosterone replacement therapy. I started in January of this year, 2021. Up until that point, I've been all natural, and I am 42 years old now, and after talking to my doctor and doing blood work with him, we thought it would be a good fit for me. So we want to obviously dive into those questions, because there are a lot of conflicting views, and everything from administration to a lot of the other things we just talked about off camera that Dr. Frank is going to dive into, and we'll kind of go in again to the most prominent questions. And if there's stuff we didn't cover today, no worries, ask some more questions, because I am going to do a follow-up video as I get more blood work, since we do it, quarterly or more.
Yeah, so great. Dr. Anthony Frank, naturopathic doctor. My focus and specialty comes in where I like to start with a natural approach to medicine. That's my baseline for anything that I do, whether it's hormone replacement therapy, whether it's gut, whether it's various, treatments or various disease processes. I'm starting with foundational. So when it comes to the hormone replacement therapy aspect of it and TRT, definitely want to start off with what can we do dietarily, what can we do physically with exercising, what can we do nutritionally, what can we do with especially some of the specific nutritions and herbs that are used. So that's one approach. That's foundation, that's always going to be there. Herbs are always going to be there when it comes to me as a naturopathic doctor. Looking at the numbers isn't always the last thing that we do, because some guys could have and feel great and they're at like 150, 200. Other guys will feel completely horrible and their numbers are like at 600, and we're talking about total testosterone levels. So TRT is going to come down to an individual conversation that you have with your doctor, managing the symptoms, looking at the entire future of what you want to do in life, partner, kids, just evaluating all of that to make sure that it is the best fit for you, which in this case, it was going to be a best fit for Weston here. It's always going to be a discussion with your doctor about what exactly we should be doing.
Yeah, that's great. I love your approach on it, because it's conversational. I feel like not a lot of doctors could just jump to a conclusion, but you think of it from every angle, and the biggest thing that resonates with me is that you care about the nutritional aspect, prevention versus just either damage control or prescription right off the bat. So that's a huge difference I know it's working with you. And I know we're already into this video, but I do want to thank you for doing this because it's just really cool. Yeah, it's just an awesome opportunity where maybe some professionals might be too busy, and I know you're busy, so your time means a lot, and I think everyone else probably appreciates it too.
I think above all, you just having this opportunity or giving this opportunity just to discuss this a little bit more, you know? Because as a naturopathic doctor, once again, this is where we thrive within this face-to-face interpersonal relationship that we have with our patients. So always want to make sure that we have these deep conversations, not just I'm your doctor, I look at your labs and I treat you in this way. So thank you for the opportunity to actually discuss this. And above all, thank you for taking charge of your health. I always applaud my patients, applaud those that I'm partnering in health with, because health it's yours to take charge of. Don't ever feel like it's ever something that is out of your control. So always feel empowered. Yeah. Health is wealth. It is. It definitely is.
All right. So as promised, we're going to address your questions, the most prominent ones. Let's start with the fertility stuff. So Justin C says, what about fertility? I believe TRT makes you infertile from what I've read. Have you checked that out? Any test results? What do you think?
So when it comes to TRT and the fertility component, that is a conversation that does have to occur before starting, which is why in my realm, I like to start with various natural approaches before getting to exogenous or testosterone that's from outside the body, because it will affect what happens inside the body. Infertility can occur, but it depends on what levels you're pushing. So with testosterone, the higher you go, think of it as the less your body needs to make. The less your body makes, the more changes in tissues and structures that you have, specifically the gonads and the testes. Testosterone affects a specific hormone called FSH. That FSH affects the development of sperm. So when it comes to fertility, your sperm developing or growing or actually becoming active is affected by the amount of testosterone coming in. There are various approaches to counteract what's happening there. Of course, the key thing is to make sure you're not at too high of a dosage of testosterone. That's one big thing. The second is always going to be addressing sort of the concerns when it comes to, how should I put it, diet and lifestyle. Your diet and lifestyle play a big role just even before you get on TRT in how testosterone is created and produced inside your body. So with your diet and lifestyle, eating clean, making sure everything's healthy, making sure when it comes to spermatogenesis, the creation of those little swimmers, you want to make sure that your diet is adequate for that. Now the infertility part, once again, that's a big conversation, but there are ways, of course, that you can taper off or figure out a dosage or get off completely, so you can kind of shift your body into trying to create whatever testosterone it used to. Now it's hard, it's difficult, and once again, the conversation has to be had before starting everything in general, but it doesn't mean it can't be done. And I have a unique list of tools in which I love to bring on herbal approaches to try to support those testosterone levels. I love to bring on nutritional approaches to try to support testosterone levels, and then on top of that, provide better fertility health. So the infertility can occur. Definitely you want to have the best options, the best outlook, and to know that if you do start, it does take a while. Usually after 6 months to a year of being on testosterone, it does start to get a little bit harder to get off of it. That time frame is used to kind of tweak your numbers anyway. But in general, the infertility is a major one, but there are ways that we can definitely approach it and figure out what the best case scenario can be so that you can always have the family that you want.
Right, so if Katie and I decide we want to start having kids, I'm not infertile permanently because I made the decision to be on TRT at the moment.
Yeah.
Correct?
Yeah, but it will take some time to kind of get back. So that's why even preconception care for me as a naturopathic doctor takes 3 to 6 months in females. So it's kind of the same timeline that might occur in a male. You know, you want to make sure the ground is ready and fertile to be able to produce beautiful things.
Cool. Okay, question number 2, coming from Isaac Markovich. Thanks, by the way, for these questions. How about the risk of losing hair going on TRT? I'm sure you looked into that and how to avoid hair loss. Can you please share that with us? As you know, I've been blessed with a thick head of hair. I'm very grateful for that. So the idea of losing it is definitely terrifying, like it is for most guys.
Yeah.
I've experienced a little bit of thinning, but it hasn't been to the extent where I'm, freaking out. No one has noticed it at all. And it also is part of what I mentioned in my last video, where we're still in the early phases of figuring out what the best dosage is going to be. You can't just nail it right out of the gates.
That's right.
Maybe if you get lucky. So I think once we get in a sweet spot, I'm assuming that, side effects that are less desirable will taper over time.
Yeah. So when it comes to the hair loss component of it, testosterone is always tricky. Testosterone replacement therapy is tricky. But it comes down to kind of the conversion. How much of it is converted into DHT? That's a more potent level of testosterone in the body. DHT can affect hair, which is where male pattern baldness can come in sometimes. It also affects your prostate. So before even starting TRT, looking into your DHT levels, getting those baseline hormone levels are going to be key. And of course, every couple months, tracking and monitoring to make sure those levels are okay. So I would more so say keeping an eye on the DHT and keeping an eye on how substantial the hair loss is.
Sure.
Would be key things to help kind of manage what's going on. I like to use herbals once again. So things that are 5-alpha reductase inhibitors, those are specific medications that kind of stop that conversion of DHT or testosterone into DHT, and more or less can stop a lot of the thinning and a lot of the prostate effects that can occur. But number one, the biggest thing is not being on too high a dosage of testosterone. That's a key thing. That's what it's all going to come down to, getting the right dosage and getting the right numbers to kind of go along with that. Having that right amount in there and being able to herbally use herbal 5-alpha reductase inhibitors. In my case, I like to use PyGM is one. There are certain nutrients like zinc that also help out. Of course, the typical modern medicine route is to use some finasteride, use something along the lines that can stop that, but there are different approaches that we can use to control, stop, just mitigate a lot of the issues.
Great, a lot of good info.
Yeah.
Wow. All right, moving right along. So we have another question from Sam Hoffman. Thanks for the question. It says, hi Weston. He's kind of curious to summarize. It's kind of a longer question, but what type of testosterone are you taking? Asking about my dosages and then also the way I'm administering it. And like I said in the previous video, I don't discuss my dosages because it's very unique to every individual, correct? So yeah, maybe you could talk about the various versions of administration and why we kind of decided to go the route of injection, I guess. Right?
Yeah. So there are multiple ways to administer testosterone in the body and a lot of the hormones that we do. There are ways that are better and some ways that you may not want to use. When it comes to the multiple types, we can always start off with gels and creams. That's sort of the introductory where you don't have to inject yourself every day. The one drawback with gels and creams is that they can tend to, if you're not careful, pass it off to your partner or your spouse in that case. So not only are you on testosterone replacement therapy, but your spouse or partner is as well. So that's where gels and creams have kind of a drawback, as well as they're a little messy at times. They can be very messy. The other approach is, of course, injection. There are different forms of injections of testosterone, cypionate, propionate, just various ways that they are. Most of them oil-based, and the tissues that you're injecting into are also a factor. So injection therapy has been, for the most part, one of the most effective ways to maintain as well as get a decent dosage into the body. The frequency of injection, that's individual. Most of the time, it's going to be at least once or twice weekly, and once again that depends on the dosage. So dosage comes down to what your numbers look like. Testosterone replacement therapy using injections is the more common route for most men, and also one of the best ways that over the long term it can be maintained at a pretty beneficial level. The third one is pellet therapy, and this literally is inserting a little pellet or two into the glute and not having to inject yourself daily. Drawbacks of that is that you get these surges and definitely the dropouts at the end. So while the testosterone goes in, feels great, you're doing awesome, after let's say 2 months, 3 months, and they are replaced or done every 2 or 3 months or so, maybe even longer. But after that time period, you kind of get a plateau or a drop off, and that makes you feel really bad. So you just keep going through these highs and lows with pellet therapy. But to the person that doesn't want to inject every day, it is actually a good option. So the various ways of actually administering testosterone into the body just depends on the individual, the doctor, and what they have seen as the best approach to get the results that the patient wants and that they want to, as a doctor, see.
Sure.
And not exacerbate or worsen anything else.
Sure.
So
yeah, I think when presented with the options, I'm immediately like, okay, I don't like needles any more than anyone else does, but I'm like, I want consistency. I don't want to go with the, oh, this is an okay route. Like I wanted to try to stick with something that was going to be steady. And then the pellet thing just sounded bizarre to me too, so I didn't want to do that. And I also heard that, like, you know, with anything, if it's surgical to even the smallest degree, like infection could be
any procedure, even
procedure.
Having a cut, you know, anything can lead to infection. So
yeah, and then the gel, that's just hilarious to think that I could be giving Katie a dose of testosterone when we get too close. So. Yeah, and the needles thing too. It's like I'm doing once or twice a week, you know, thus far on average from starting in January, and I am so used to it now. It's not that bad at all. And like I said, I hated needles, so you'd be surprised what you get conditioned to once your head is out of it and you know how great it makes you feel. So.
Yeah, and even to build on top of that, actually, the tissues that you're injecting into, once again, anatomically, muscle, that glute area that you want to inject into, muscle has a lot more blood vessels, which means your dosage gets into your body a lot quicker, things are used a lot more efficiently. And adipose tissue or fat tissue is also another option, but that's one that can last longer. So tissues are also dependent, which once again, it comes down to having that discussion with your doctor and seeing, hey, which tissue do I go with? Most of the time, I lean toward go with the muscle tissue. And on top of that, I always lean toward how do you feel? You know, how are you feeling? And I line it up with the numbers. So practicing that evidence-based medicine. What is the research showing me? What is my patient telling me? How can I marry both worlds and make sure that we get you feeling great and doing great?
Yeah. Good stuff. All right. So William O'Connor says the test should be injected into the muscle and HCG into the fat tissue. HCG is a water-based peptide and the test is oil-based. So it's obviously a statement, but wanted to bring that up because it was a prominent question on how to administer in the two different methods.
So that's absolutely correct. Testosterone, especially testosterone cypionate, is in an oil-based form. You want to inject that specifically or preferably in the muscle. Adipose tissue, of course, when you think of fat tissue, it's built up of various things, but of course fat is almost closer to that oil base as well. So you don't want things lingering around too much that can then lead to other issues. So the oil-based testosterone is going to be good, once again, in the muscle because of those blood vessels and the way it's absorbed and the way things can kind of spread out. The HCG being a peptide / almost a way of getting it in is a lot easier. And for the most part, with the HCG, it does affect your testosterone as well. So with that being said, it does come down to an individual. The most common and the most research has been with doing the intramuscular injections into your muscle. But when it comes to technique, sometimes I've noticed some men are like, hey, I've been doing it this way. And when I look at their numbers, I'm like, that's interesting because now your numbers are still looking pretty good. Or now your numbers have changed. What have you changed in technique? So the technique, the location, the tissue in this case does play a role in it. Going back to that HCG, affecting the testes, is causing testosterone to be produced. HCG is brought on board to kind of maintain the gonads, make sure that those are still functioning and those are still working. So once again, a good example of things that you can probably do and not be completely infertile. You know, you don't have to get to that realm of infertility. There are things that can be done to support. So yeah, great question.
Yeah, and we brought it up too because my last video, I said I was doing it the opposite way.
Yeah.
Now, we didn't start that way, but we explored that. I had mentioned to Dr. Frank that I had seen some other doctors say they had great success with patients, even though it wasn't exactly the method that is commonly used. And sure enough, for whatever reason, my numbers were really great after that, and I was feeling amazing. So you were just happy about the results, and so we kind of were okay with it at that point.
Yeah.
So I don't know. I mean,
at that point, of course, it's still, you know, trying to make sure that it's still working for you, that the numbers are still doing pretty good. But at that point, it's you know, something that you observe and see that there are other ways, other approaches that can be used. So yeah,
evidence-based, I guess, right?
Yeah, it's always, once again, evidence-based, saying this is what research shows, but then at the same time, this is what patient, client, what the individual is going through, and how can we figure it out together. That's why you always want to create a good team with whatever doctor you start or have a discussion with.
All right, we're trying to move along quickly, but obviously this is a deep dive, right? So if you've lasted with us this long, we appreciate you being here. And of course, make sure you subscribe and like this video and comment below if we missed anything, like I said. So without further ado, we are on, it looks like question number 5, if I'm tracking correctly. I'm not sure if I'm gonna pronounce your name right, apologies. Shamon says, once on TRT, always on TRT. Once you start, your body will produce even less testosterone since it's already being provided. You have to stick with it. He says, I plan to do it when I'm a bit older. Saw this a lot in the comments, so really wanted to touch on this because obviously the commitment sounds pretty intimidating at first glance, right?
Yeah, it is. Which is why that discussion with the doctor is going to be sort of key. And make sure you find a good doctor that's going to touch on every aspect before going to TRT. If there are no other options that they're presenting to you before TRT, then you may want to keep exploring. Going along with that comment, that's you know, going absolutely in the right direction. I would put a caveat in there that once on TRT, there is a way that once again you can try to decrease your dosage. You can try to figure out other means and methods. And from my aspect or my view of it from a naturopathic doctor, it would be more so to take a look at it from what exactly can we use herbally, nutritionally, to make sure that we are feeding into that pathway, feeding into your hormones, so that you don't even have to get to the step of TRT. But with that being said, TRT can be on it a long-standing or a for life situation, depending on how you want to feel for life. You know, if at a certain point the dosage is getting too high and you're just tired of injecting or applying creams, then you figure out a method or a way that you can kind of, you know, how you can either reduce or alter or change, because there are different approaches that we can use. The HCG is one that once again activates and kind of encourages the body to try to produce testosterone. So there are different methods and different ways that can be used and explored with this testosterone replacement therapy.
Yeah, because you know, the alternative is what, right? Like if I, you know, at 42, my body just, you know, stopped producing as much as I would like. I mean, what is my alternative at that point, right? We, like Dr. Frank said, his approach is to do the preventative stuff first, to not have to go that route, whether it's herbal or every natural mean possible, and looking at your blood work. And you exhaust that first. Like I said in my last video, that's what I did. That's why I've been able to go this far in life and still maintain the type of physique I've had without any form of synthetics, right? Yes, if TRT is for life, well, you know, 10, 20 years from now, if I decide to get off it, like what benefit would that be for me necessarily, as long as, like you said, the administration isn't getting ridiculous and it's being, you know, terrible. But what is the alternative is the question, because you are just fighting the clock. Like, age is a real thing. So to that question, to those statements, I ask you, if you have better alternatives, of course, the conversation should be had. So
Yes.
I'm curious, but thus far, it seems like the best option, depending on the patient, and I'm that guy today. All right, this is good times. I hope you guys are feeling informed. Here we go. So Uncle Corky says, very informative video. Thanks. Would be neat to see your doc on as well. And by the way, what kind of medical specialist would be most knowledgeable to interpret blood work for low T? I'm assuming a urologist or an endocrinologist, but I'm not really sure, question mark.
That is an excellent question. So honestly, both a urologist, of course, urology dealing with the urinary system, which includes hormones, would be a number one option in this case to really evaluate the structures that are associated with the urinary tract and urinary system in a man. An endocrinologist is definitely excellent at evaluating your hormones. If you can find an individual, in my case I'm a naturopathic doctor who has done intensive study into, or at least done my due diligence in investigating hormone replacement therapy, how it works, what exactly it's comprised of, and what the best approaches are. So while there are different doctors and different ways to go about it, a urologist I would say is a pretty good option and would be a lot more accessible, because naturopathic doctors and naturopathic medicine may not be as accessible, whether it be in your city, your state, your country even.
Or your plan, right? Like
or your plan.
Something in network.
Yeah.
For example, yeah.
But always make sure that whether it's a urologist, an endocrinologist, always make sure that they at least have, let's say, a functional medicine approach, an approach that does combine both diet, nutrition, lifestyle, to make sure that they're checking all the boxes, crossing all the T's, dotting all the I's, and making sure that you get the best care possible before delving into something like TRT. So
that's why I like that you did like a micronutrient panel with me. He was looking at my blood work from top to bottom.
Yeah.
Let's look for any red flags before we just assume everything is hormone related, right? So
yeah,
I appreciated that. Okay, well, that was good times, and I feel like we covered a lot of ground. And again, if we didn't get to your comment, because there was like 400 plus comments, so really tried to, like I said, dive into the ones that were the most prominent. Feel free to ask again, because I am going to do future videos on this topic, Still in the part of the journey. I don't know everything. I'm not an expert on this, and that's why I refer to Dr. Frank. And as we go on this, it's on a quarterly basis. We're doing blood work, and we're just trying to get me to feeling the best, be feeling as best as possible. So that's the dealio with that. Obviously, of course, subscribe to this video. Before I go into some other stuff, I just want to leave it to Dr. Frank real quick, because I'm just grateful to have him on this video, and I hope you guys really enjoyed having him.
Yeah, it's been an honor. I appreciate the time, appreciate the conversations, and great questions coming from all of you guys. Definitely having that conversation with whatever doctor you choose to move forward with, and just having a conversation about health is really an ideal thing to have, in that given our current landscape of health and wellness, we want to invest in our health right now so that we don't have to pay for it in the future. So invest, find the right fit, find a great doctor that you can have a conversation with that's going to give you as the individual, you as the patient, the best approach and what works for you. So definitely thank you for having me.
Sure.
Dr. Anthony Frank, naturopathic doctor. I love what I do. I enjoy the holistic approach to medicine, modern medicine, herbal medicine, just bringing it all together and making it into this happy stew, I guess, of naturopathic medicine.
That's awesome.
Yeah.
I love it. I love that Dr. Frank opens it up to all the elements of our body. It's not just always about synthetics.
Yeah.
It's not just always about medicine always being one way and it will always be that way. We discover and knowledge expands as we move forward as a people, and so it's just cool to be lined up with someone with an open mind, and I appreciate that very much, Dr. Frank. So.
Of course, of course.
Before I go, like I said, the most practical way to support my channel is to check out my menswear line, and I also said make sure that you use your code at checkout so you can save quite a bit on every product. So the code's going to pop up on the screen. This is my latest release again, the Traveler toiletry bag. It turned out amazing, and as you know, we are starting to travel again post-COVID, so make sure you have something that will get you taken care of for a trip longer than 3 days, right? I designed this thing from top to bottom over the last year, and I couldn't be more happy with it. In addition, check out some of my pieces that are dropping over the next month or so. A lot of things for the colder weather. I just have so many things in development that I'm excited about. And again, if you lasted this long in this video, I appreciate you being here. Thank you again. I'm Weston Boucher. I will see you guys next time.